I'm Dr. Sanjay Gupta. I'm a senior consultant physician in internal medicine and diabetology. I'm working at Prima Diagnostics at Sajapur Road, Bangalore for the last 10 years. I have an experience of about 20 years in the practice. One of the most dreaded complications of diabetes is diabetic foot. Very surprising. Some people find it very amusing that why are we even talking about taking care of the feet in diabetes? Well, first of all, look at this in a physiological way. Our feet, our lower limbs, are the dependent part of our body. Our whole body is actually supported by our legs and the feet especially. So imagine the amount of pressure they are in when they have to return the blood circulation back to the heart, and where they have to give us our standing posture and our balance on a day-to-day basis. Imagine the way the nerves are behaving in diabetes. We all know that there are two complications in diabetes as internal complications. One is the angiopathy, microangiopathy and macroangiopathy. Basically, it means that the blood vessels are getting damaged. The other part is the nerves. The nerves get damaged in diabetes, and that's what we call it as neuropathy. Now, peripheral neuropathy means the nerves which are at the end, the terminal part of our body, like especially the hands, arms and the legs. So what will happen is when both get affected, and diabetes causes neuropathy and vasculopathy, that is angiopathy, in the legs more dramatically higher than the rest of the body. Only because our nerves in the legs are specialized, are having a lot of bigger tasks to do than the rest of the body. And the blood vessels are more under pressure in the legs. So if there is any affection of diabetes in the legs, it will lead to diabetic foot. You will see color changes. How do you make out diabetic foot? For example, you might see color changes because lack of blood supply. You might also get funny sensation of tingling and numbness in the feet. When you are way beyond complications in diabetes, you will find that the legs are becoming numb while walking, while standing, and you might see color changes. Ultimately, the end product or the end outcome of this diabetic foot is gangrene, where you will find that people have to go and cut their legs. They have to get their ankle amputated. They have to get their legs amputated. Amputated means cutting off the dead portion of the body. And that happens very commonly in diabetes if you don't look at the legs. So generally I tell my patients, we have a tendency to look at the mirror when we get up in the morning. I said, don't look at the mirror, look at the legs first.